Black lung disease. Hi everyone. So what is black lung disease? My name is Dr. Purvi Patel and I'm board certified in family medicine. And I have a wonderful friend with me here today, Dr. Esther Ajarapu. She is also a board certified family practitioner and certified in occupational lung disease management, treatment, and evaluation. And she specializes in black lung disease, and she will tell us a little bit about what black lung disease is and how we can prevent it and what the future holds. So welcome, Dr. Ajarapu, and thank you for spending some time with me. She is also a dear friend, so please tell us a little bit about black
Thank you,
lung.
Dr. Patel, for this opportunity. So, black lung disease is a disease that coal miners, people who work in the coal mines, end up getting because they're exposed to coal dust and silica. And this inhaled coal dust eventually is not able to be cleared up through natural mechanisms and gets embedded into the lungs and creates this immunological reaction and forms fibrin and fibrotic lung disease and eventually progressive lung disease. So currently there is no lung, the treatment to cure. What we hope to do through this educational piece is make people aware of the disease and what we can do to delay the progression of the disease.
Okay, and so how do we delay? What are some of the methods that they utilize now to prevent it from occurring and also to delay the process?
So in 1972, Congress passed what we call Coal Mine Safety Act. Under this provision, companies are required to basically monitor the dust intake by the coal miners who work in the underground coal mines. They have different ways of reducing the dust by giving them face masks, respirators, and there's a certain amount of dust measuring that they have to do, and they have to comply by OSHA regulations. And so under these provisions, people are supposed to basically change the filters, make sure that they wear the face masks and things like that to hopefully reduce the amount of inhalation of coal dust and silica.
Got it. And are they effective? Are we seeing effectiveness over time in prevention of this black lung when they use these masks correctly, like the filtration masks and the respirators?
So what we are seeing is that because of the modernization of technology, we are able to go deeper into the core of the mountain where there are a lot more toxicity. So you have the diesel, fossil fuel exposure, and these machines are pulverizing the rock into more fine respirable coal dust. And so even though they do have these dust regulations, the safety is an issue. They're having to stop the production to change the filters and things of that nature. So I think that on one hand, yes, we are making headway. On the other hand, we are seeing the disease in much younger population.
Is it because the younger population is now working in the coal mines, or so what has changed the demographics? So why are we seeing it in the younger population?
So the disease that we're seeing in the younger population is because of the modernization of technology, and because the number of hours there. For example, all the small coal companies have been bought out by larger companies, and so the larger companies are able to use the technology to produce more coal during less time. So there are a lot more younger people that are working. But because, keep in mind, coal dust disease, coal mine lung disease, or black lung, like the lay people term it, is a disease that occurs over time. That's why we call it a progressive disease. Our natural mechanisms don't clear this disease. All the ciliary mechanisms don't clear these particles, and so they get embedded into the parenchyma of the lung, and they exert the influence on a chronic basis, so that you end up having this progressive lung disease. So how do we treat this lung disease? We pretty much term it COPD due to occupational exposure. And so we use the same medications as we do for COPD, such as Symbicort or Spiriva, Brio and Noro. So all these different medications, either they're dual medications that kind of open up your bronchioles, reduce the inflammation, therefore excess bronchitic production or mucus production. So those are the two pathways that we aim at treating the black lung disease. And then of course in the end stage, oxygen. Most of these patients end up oxygen dependent.
So is there pulmonary rehab for those patients? So for example, when we have a COPD patient, sometimes they have specific pulmonary rehab where we can help by tapping the chest, or there's special vests that they can wear to help loosen up some of the mucus plugs and expectorate then some of the inflammatory particulate that they have.
Yes, certainly they do have pulmonary rehab, and we have seen strides in those who actually adopt pulmonary rehab into their daily treatment plan or weekly treatment plan, and they are very successful because it helps them be more active. And part of the problem with some of these coal miners is that when they do get into the end stage lung disease, their activities of daily living obviously are affected. Bending down, tying their shoes, or showering, they're out of breath, and so pulmonary rehab really helps them. And so part of the problem obviously is being able to afford or get those provisions covered through either their insurance or through the black lung card.
Which is, the black lung card is more of a government, like a federal benefit for the patients?
Well, not necessarily. Basically, these coal miners have an opportunity under the provision of Coal Mine Safety Act to apply for a black lung disability benefits, and they have to go through a process. They can apply every 13 months, as many times as they want to, but they do have stringent requirements. They have to meet all of these, the rest. They have to do arterial blood gas testing, they have to do pulmonary testing, there is an EKG, chest x-ray. So there are different modalities that we use in trying to determine whether a miner is eligible. So once we deem that the miner is eligible under these criteria, we send it back to Department of Labor, and then if they have a responsible operator, a company that they work for that's still in existence, then the miner also goes to an exam with them, and so it becomes a battle between the company and the miner. And so eventually, if the miner, the objective data qualifies them, then eventually they will get the disability and therefore the medical card. But it is such a litigious, arduous process that it takes sometimes a year, sometimes 5 to 7 years before they can get these benefits. And some of these miners die before they can even see these benefits come to realization.
So your job is to help them fight for benefits sooner rather than later. I mean, these are American citizens that are helping us get energy. And so your job, please explain to me what your job is and everyone else out there. So you help fight for them, right?
So what we do is try to give a well-reasoned medical opinion and stand by that opinion, so that when they do go to the opposing party, that our opinion has a good sound basis backed up by research. And so a lot of these coal miners obviously don't have the resources to get their own lawyers, so they do have HRSA funded clinics that help these individuals to be able to apply for these benefits. So not everyone, even if they are eligible, unfortunately, do end up getting these benefits because of the way the process is.
Okay, so I mean, in my opinion, all of the miners should get the benefits. It should be funded by the federal government, and also, you know, going forward, let's say, you know, so how do we improve this in the future? What are the goals for the future generations?
And so I know that there is a big push for clean energy, clean air. We all want that in our environment, and so we are encouraging people to use non-fossil fuels such as solar and wind and things like that. So going forward, I think for the miners, just like you said, not make it a litigious process. Maybe some way that these people can apply for benefits if they worked, try to help them get these benefits. They have worked all of their lives to try to give us the electricity and to be able to use the coal in production of steel and other you know, other such things that we take for granted, for example. And so going forward, I think what we'd like to see is that, number one, help these individuals who have already worked in the coal mines screen early and diagnose early, treat them, give them ways that they can prevent secondhand smoking, go for physical therapy, go for pulmonary rehabilitation, and then of course access to medicine. A lot of these coal companies and coal miners work in underserved medical areas, so the access to care is difficult for them. And so government needs to find ways that they can help the coal miners be able to get access to healthcare.
Okay, and I mean, and going forward, you know, I mean, improving the use of energy, not necessarily
Absolutely.
Reducing fossil fuel use and going towards the other
Cleaner.
types. So good. Okay. Well, I think that's great. Thank you for this wonderful message. Thank you for spending the time with me here. And I look forward to seeing you again.
Thank you very much, Dr. Patel. Thank you for this opportunity. I hope this little clip would give you your audience some information, and hopefully we can continue to do these to help our communities and help our environment.
Great. Thank you.